Hello again. We will conclude Chapter 7 by discussing articulations. Another word for articulations are joints. This is anywhere two bones come in contact with each other. The function of articulations or joints is it enables body movement, it helps to bond body parts together, makes bone growth possible, and permits shape changes during childbirth. Joints can be classified by their degree of movement. Some joints are totally immovable, and these are referred to as synarthrotic. Some joints are slightly movable. These are defined as being amphiarthrotic. And some joints are freely movable. These are known as diarthrotic. Joints can also be classified by the type of tissue that binds the two bones together. There are three types of bones classified in this way: fibrous, cartilaginous, and synovial. Fibrous joints. Fibrous joints are where bones are held together by dense connective tissue. Most of these are immovable. An example of this is the sutures of the skull. The word suture means seam. Another example is gomphosis of the teeth. This is the connection of your teeth to the bony tooth socket. Some are slightly movable. Example of this is the joint between the distal tibia and fibula, and the same type of joint exists between the radius and ulna. This diagram is showing a suture, and it looks like a seam that you would generate while sewing. You can see the gomphosis. The periodontal ligaments are the structures that connect the tooth to the maxilla. We view these in our PowerPoint on the appendicular skeleton. This is an interosseous membrane that's made of dense regular connective tissue that connects the radius and ulna and also the tibia and fibula. There's just a little bit of wiggle room, and it keeps these bones parallel to each other. Some joints are made of either hyaline or fibrous cartilage. An example of this is the epiphyseal plate or the growth plate found in your bones. While you're a child and you're growing in height, the growth plate consists of hyaline cartilage. These hyaline cartilage replicate, and then older cells die and are replaced by bone matrix. Once you stop growing in height, this is when the epiphyseal plate has permanently fused. So this is only found in growing, humans or other animals. The intervertebral discs are discs that are found between the vertebrae, and they act as shock absorbers. These are slightly movable. There's a cartilage joint between the first rib with the sternum, and a cartilaginous joint that connects the two pubic bones. This diagram is showing you the growth plate. You can see it connects the diaphysis and the epiphysis. It's showing the costochondral joint and first sternocostal joints and the intervertebral discs. This diagram is giving a larger view of the intervertebral discs as well as the pubic symphysis. This joint is slightly movable and becomes a little more loosened in nature during childbirth. However, most joints found in the human body are classified as synovial. These are freely movable. They are much more complex than either the fibrous or cartilage joints. Synovial joints consist of a joint capsule and some additional structures. The ends of all the bones found in a synovial joint are covered with hyaline cartilage that's sometimes referred to as articular cartilage. You can see this, for instance, if you look at the end of a chicken bone. The joint capsule consists of an outer layer of dense connective tissue that joins to the periosteum of the bones. The inner layer consists of the synovial membrane, and the synovial membrane generates synovial fluid. Synovial fluid has the consistency of egg whites, and it acts as a lubrication. The key point in synovial joints is that you never want bones to rub up against each other. That would lead to osteoarthritis, which sometimes happens in individuals. This diagram shows you the joint capsule. There are some additional structures that may be found in synovial joints. One of these is a meniscus, menisci, plural. These act as little shock-absorbing pads of fibrocartilage. Your knee contains a meniscus. This increases the distance between the two bones to prevent them from rubbing up against each other. Bursa are little fluid-filled sacs. These are found in areas when a tendon is sliding over a bone and it acts as a little pullover cushion. You will actually generate more bursa in areas where you have a lot of rubbing of a tendon over the end of a bone. The knee is a very complex synovial joint. In this diagram, you can see the femur and the tibia, the synovial membrane, the suprapatellar bursa, so that's found behind the patella. You can see the patella, the prepatellar bursa, the infrapatellar bursa. You can see articular cartilage at the end of the bones, and you can see the crescent-shaped meniscus. So, if you look at where the meniscus is located, this is going to prevent the end of the femur and tibia from rubbing up against each other. Synovial joints can be classified based on their shape, and the shape of the synovial joint dictates its type of movement. The most movable synovial joint is the ball and socket. Here you have a round or egg-shaped head that articulates with a cup-shaped cavity of another bone. This allows for a very wide range of motion. Example of synovial joints that are ball and socket joints are your shoulder joint, where you have the head of the humerus articulating with the glenoid cavity of the scapula, and the hip joint, where the head of the femur articulates with the acetabulum. Condylar joints, or ellipsoid joints, consist of an ovoid, condyle, or projection, and an ellipsoid cavity. This allows for a variety of movements. This is found between the joint of your metacarpals, right, so that's your hand, and your phalanges 2, 3, 4, 5. What do we commonly call this joint? This is referred to as your knuckles. So if you take your finger and move it at your knuckle, you can notice you can go up and down, side to side. You can go around in a circle. Your thumb, phalangeal 1, has a hinge joint at this location. Plane joints or gliding joints. This is where the articulated surfaces are nearly flat or they're slightly curved, and this allows for a back and forth type motion. This is found between the bones of the wrist and ankle, the joints between the vertebrae. So remember, the vertebrae are stuck together, kind of like a jigsaw puzzle, and the bottom of one vertebrae is going to articulate with the top of the one beneath it. A plane or gliding joint is also found at the iliosacral or sacroiliac joint, and the joint between the sternum and ribs 2 through 7. So you have a little bit more stability in the joint between the sternum and rib 1. hinge joints. In a hinge joint, just like the hinge on a door, you have a convex surface that fits into a concave surface. Example of hinge joints are your elbow, interphalangeal, the joints in your fingers. The temporomandibular joint is a modified joint because your jaw opens and shuts, but you can also protrude it outward, right? And you can retract it back. And between your hand and your thumb, so metacarpal and phalangeal one. The knee is also a modified joint because it has some movement in other directions. Pivot joints. In a pivot joint, you have a cylindrical surface and it rotates within a bone or fibrous tissue. This is the joint between the proximal ends of the radius and the ulna. So if you were to rotate your thumb, kind of like you're hitchhiking, right, that's a pivot joint, and the joint between the dens of the axis and atlas. This is the joint that allows you to shake your head no. Saddle joint. In a saddle joint, the articulating surfaces have both convex and concave areas. This allows for movement in two planes. This is the joint between the trapezium, that's one of the wrist bones, and the metacarpal of phalangeal 1, or your thumb. This allows you to sit there and twiddle your thumb. If you're twiddling your thumbs, the movement is coming from this joint. This image summarizes examples of some of these types of joints. Let's review. Fibrous joints are where the articulating bones are fastened by a thin layer of dense connective tissue. This allows for little or no movement. You have no movement in the sutures of the skull bones, the gomphosis of the teeth, and there's a little bit of movement between the distal ends of the tibia and fibula, also including the radius and ulna. Cartilaginous joints. This is where the bones are connected by either hyaline cartilage or fibrocartilage. The amount of movement is limited as when the back is bended or twisted. This is found between the joints of the vertebrae and in the pubic symphysis. Synovial joints. These allow for free movement. The articulate ends of the bones are surrounded by a joint capsule, which consists of the synovial membrane with the outer layer, dense layer, that is continuous with the periosteum of the bone. The synovial membrane generates synovial fluid, and the ends of the bones are covered with hyaline cartilage. Ball and socket joint is the most movable of all synovial joints. Example being the shoulder and hip. Condylar joints also allow for a variety of movement, but do not allow rotation. This is a type of joint between the metacarpals and phalanges. Plane joints allow for some sliding or twisting. Hinge joints, flexion or extension, such as an elbow and joints of phalanges. Pivot joints allows for a rotation around the central axis. And the saddle joints allow for movement mainly in two planes. This is only found between the carpal and metacarpal of the thumb. The most stable joint, for instance, the sutures or the gomphosis of the tooth, are also the joints that are the least mobile. As joints increase in mobility, there's a decrease in stability. Let's look at the types of movements found in synovial joints. Flexion is bending parts of the angle between the joint decreases. Good example of this is when you flex your biceps. Extension is reverse. That's straightening parts so the angle between the joints increases. So if you were to flex and then extend your triceps, that would be extension. Dorsiflexion is ankle movement of bringing the foot closer to the shin, such as you're walking on your heels, while plantar flexion is ankle movement to point the toes. I always call this one ballerina toes. Hyperextension is extension beyond the anatomical plane. Sometimes this is painful, but just think if you bent your neck so your head went down to your chest, right, that'd be flexion. Straighten your head back to normal anatomical position, that would be an extension. You dropped your head back and looked up at the ceiling or sky, that would be hyperextension. There are two terms here that are very similar to each other. And honestly, the easiest way to remember them is if children are abducted, they're taken away. So abduction is movement away from the midline. You can bring your arms out to your side, which would be abduction. You could flail out your fingers or toes, that would be abduction. And adduction is then movement toward the midline. Lateral flexion is when you bend your neck from shoulder to shoulder, side to side, or bending your trunk from side to side. Here are some more examples. You can abduct and adduct your leg, showing lateral flexion. Also extension, flexion of the knee. Rotation is movement around an axis, such as you'd see in a pivot joint. Circumduction is a movement that you can do with your either hip or shoulder joint. That's the end of the part follows a circular plane. Pronation and supination. Pronation is rotating the forearm so that the palm is facing downward or posteriorly. So if you rotate your arm so that your palm is facing posterior aspect. Supination, rotating the forearm so the palm is facing upward or facing anterior. So there's a couple of ways that students have mentioned they remember this. Supination, like sun, palms going toward the sun, or sup, like soup, you're holding your palm as if you were pouring soup into it. This diagram is showing dorsiflexion, plantar flexion, circumduction of the shoulder. For rotation, you could also rotate your forearm in medially, out laterally, and it's showing a palm demonstrating supination and pronation. Eversion is turning the sole of the foot outward, while inversion is turning the sole of the foot inward. Retraction is to move a part backwards. You could retract your shoulders, bringing your shoulders back towards your spine. Protraction is moving a part forward. This movement can also occur with the jaw. Elevation is raising a part. Elevate your shoulders. Depression is lowering a part. You can lower your shoulders. Here we demonstrate inversion and eversion, protraction, retraction, elevation, and depression. The end. That concludes Chapter 7.